In Bradford District and Craven, we want people to be happy, healthy at home. It's an ambition we're all working towards, but we're not there yet. There are significant health inequalities across our communities, and the gap in how long people will live is stark. Starting in the least deprived area, Wharfdale, life expectancy is 87 years for women and 84 years for men. Travelling into central Bradford, this dramatically reduces. When we reach the most deprived area, Manningham, people's life expectancy here is around 10 years less than Wharfdale. 10 miles, 10 years less life. But it's not just about how long people live, it's how well they live too. If we take away the time people are living with poor mental well-being and ill health, we get what is known as healthy life expectancy. And the gap gets bigger. 10 miles, 20 years less healthy life. People in the most deprived areas of our district are living with more ill health and dying earlier. Health inequalities like this arise because where we are born, where we grow up, where we live and work and where we grow older, all has an impact on our physical health and mental well-being. At each stage of our life, our health will be shaped by social aspects, such as the education we receive, the homes we live in, employment opportunities and income, our family, friends, and our community. Health inequalities are unfair and avoidable differences in health across the population and between different groups within society. To tackle this, in 2019, NHS England increased funding in areas with the highest rates of early death and the greatest need. And Central Bradford was one of those areas. To decide how best to use this new funding, we brought together the voices of local people through community partnerships, voluntary and community organisations, local authority, primary, secondary and community care, and public health teams. The result? Say hello to Reducing Inequalities in Communities, or RIC for short. The RIC programme takes a population health management approach. This approach uses data and knowledge about our local communities to see where there are the greatest inequalities. It involves identifying groups of people at risk of ill health and then focusing on what can be done to prevent it or help them to manage it. In the RIC programme, a number of projects have been created. Some are up and running, others are still being set up, but each project will help improve people's health and tackle inequalities at different stages of life. Birth. We want to make sure that Bradford babies have the best start in life. We have chosen a group of projects that reduce the impact of known risk factors in pregnancy. Childhood and adolescence. We want to make sure our children and young people have good mental and physical health. Adulthood. We want to address the issues that cause early death in our area. This includes focusing on long-term conditions such as diabetes and the health of the homeless. Later life and end of life. We want to support people as they age, providing proactive care to help manage complex conditions. This includes a holistic approach to mental and physical health support, which is not always just medical. Each project is made up of organisations and partners working in communities and who understand the health inequalities people face. The RIC programme is an important step for us in our work to reduce health inequalities. We need to be sure that what we do makes a real difference to our population. We've created the Bradford Inequalities Research Unit as part of the programme. This helps us to understand the causes of ill health and inequalities in Central Bradford, identify areas to prioritise and build an evidence base of what works. COVID-19 has shone a harsh spotlight on existing health inequalities, so it's vital we continue our focus on this work. Although RIC is starting in a specific area within Bradford and Craven, we're designing the programme so it can easily be extended to other areas in the future. At the heart of the RIC programme is the determination to work together to do whatever is needed to reduce health inequalities, to take back those 20 years and close the health gap, so everyone can live healthier, happier, and longer lives.